My name is Pharmacist Nafiu Abdullahi. I'm the State Culture Officer of Sokoto State. I think New Incentives are the only organization that organize such kind of program, because I could remember there are many partners supporting immunization, but there is no any partner that is calling CCOs and zonal CCOs together with the high-level people at the national to discuss issues with regard to the supply chain. But New Incentives have found a way of doing that quarterly so that to support the supply chain at the various states and make sure that the vaccine is available at the health facility level and LGA level and even at the state level. And it has really give a good impression, and also it has really solved a lot of issues with regard to the supply chain problem, especially if we talk about stock out of antigens in different facilities and also at the state level. Coming to this program today, I have seen a lot of changes. Before, we only talk about what New Incentives does in the state and also what are the stock out. But we have included another new thing that's very important, Open LMIS. And this Open LMIS, if we triangulate the data of Open LMIS with the data that is reported from the site, then we can see whether it is real or not. And we can see we have a good reporting data. And also at the same time, it's only when you are using a Open LMIS that you can have a real-time data. And at the same time, if you are not using a good data at the Open LMIS, it will affect even the supply chain at the facility and at the LGA and also at the state level. Sokoto, we are part of the state that has a low coverage in immunization, especially RI vaccine. And looking at the area, a lot of people are not coming to the facility to access the vaccine due to the issue of poverty, some due to the issue of lack of awareness. But New Incentives has done a lot, because with that amount of money that they are giving as a transport allowances to the caregivers, it makes many of the caregivers to take their child to the facilities for immunization. And at the same time, New Incentives has gone beyond that, because they help a lot in making vaccine available, even at the state level. Because anytime we have stock out, we have no any partner that supported except New Incentives. They have supported us many times. And even recently, when we have issue with our transformer in the state coastal, New Incentives donated over 1 million to repair the transformer. So they have gone beyond what their money. They have gone beyond giving money to the caregivers. So they really have a good impact in Sokoto State, and we really appreciate their effort. Yeah, one of the areas that I want New Incentives to improve is with regard to the data quality. All the data that we are getting from the health facility is the one that we use for the informed decision. So if we are not getting exactly qualitative data, then all our decision will be wrong. So I want the New Incentives to deep dive to make sure that those data that are being collected at the facility level is being transmitted into the data tools, and at the same time make sure that the data tools are being used to be uploaded in the HIS too, because it's only when you report vaccine utilization that you can have justification of what you have used. And at the same time, I want the New Incentives also to help at the national level to make sure that anytime there is out of stock of vaccine in the state, they help and distribute vaccine, because most of the issue that we are hearing from the national, they are saying that there is gap in pounding of transporting vaccine. So it's not that we should just sit down until we have a stock out, then we request for the help from New Incentive. But they should be involved directly in transporting vaccine from the national to the state level, because I believe if they involve fully, there will no way we have stock out at the state level. And if we don't have stock out at the state level, I don't expect we have at the LGA and the facility level. Okay, with regard to this training, I want the New Incentives to, though they have tried, but I want them to make this training days to 3 days, so that we can digest more of the data that we have reported from the field, and at the same time to also discuss more on Open LMIS so that we can have a wider coverage and also more interactive session so that we can understand more with regard to the supply chain and also to the program implemented by UNICEF. You know now, well, this world is a small village now. People are all over social media. I have seen one post last time in Facebook that one lady, she's asking with regard to the money that new centers are giving, and the person that responds to her is a new incentives staff, and I like the way he responds to her. He has mentioned the benefit of immunization. He's pharmacist. He has mentioned the benefit of immunization. He has mentioned the schedule of immunization, and then later on, he mentioned to her that this money that we are giving to you is not a bribe, but rather is the transport money for the caregivers. And she was like, she understood everything that he has said to her. So if we have such kind of engagement and awareness on social media, I believe a lot of people will be educated. Yes.